Hi guys, and welcome to the mnemonics video. In this video we'll be using the mnemonic acid meals to help us remember the antacids. Again, we want to thank Tony Guerrera for providing or coming up with this mnemonic, and we'll use it to learn our antacids. So a standard exam question may ask you, when should patients take their antacids? The answer is 1 to 3 hours after a meal starts producing acid. You use antacids after there is a rise in the acid in the stomach, much like a high tide, except it's the food that triggers the open floodgates of acid in the stomach. Therefore, our vertical mnemonic is, in all caps, acid meals. A, aluminium hydroxide, sort of alludes to the liquid viscosity of it. So after A we have C, calcium carbonate. Calcium carbonate is the active ingredient in children's pepto. Pepto Bismo for adults has bismuth subsalicylate as its active ingredient, with an aspirin-like ingredient that could cause Rye syndrome in children. What's confusing is that children's pepto is a tablet. Adult Pepto Bismol is a pink liquid. Usually the children's dosage form is a liquid and the adult form is a tablet, which can cause parents to think it's okay to use Pepto Bismol for children. That's incorrect. Do not use salicylate in children. Don't interchange calcium carbonate, which is children's pepto, and bismuth subsalicylate, the adult Pepto Bismol. They have different ingredients. Next we have D. Decrease phosphate with aluminium hydroxide and calcium carbonate. Hypophosphatemia, some antacids cause. You can think aluminium and calcium are pals with phosphate. So binding it up and decreasing the amount of phosphate levels. Then we have I, which stands for ions. So chelation with fluoroquinolones, levothyroxine, and tetracyclines. I stands for ions. So chelation with fluoroquinolones, levothyroxine, and tetracycline. The three multivalent cations: aluminium, calcium, and magnesium. Multivalent means that there is a charge higher than the one ionization. Therefore, aluminium Al plus 3, calcium Ca plus 2, and magnesium Mg plus 2 are multivalent. Multivalent cations chelate with certain antibiotics, including fluoroquinolones. Fluoroquinolones like ciprofloxacin, moxifloxacin, and levofloxacin. They also chelate with levothyroxine, a thyroid replacement medicine, and tetracyclines like doxycycline, minocycline, and other antibiotics. Chelation is the name of the binding. It makes these medicines more or less effective. To remember this, think of the letters from the word chelate. C for ciprofloxacin, L for levothyroxine, and T for tetracyclines. Next in our mnemonic we have C, constipation. Reminds us that aluminium hydroxide and calcium carbonate cause constipation. M stands for magnesium hydroxide. Its side effect of diarrhea is a therapeutic effect as a laxative, a drug class we'll talk about later on. We want to be careful about high magnesium, and especially the buildup in patients with chronic kidney disease, CKD, because chronic magnesium use can cause fluid loss. We also watch for electrolyte imbalances. A, we have as needed, or PRN, rather than scheduled, refers to antacids are used just when we need them. L stands for laxative effect of magnesium hydroxide. It contrasts the constipating effect of aluminium hydroxide. L stands for sodium bicarbonate. It's easy to remember because metabolic alkalosis is an increase in the serum bicarbonate. Concentrations from your acid base and electrolyte study. Sodium bicarbonate makes your stomach much more alkaline or less acidic. For those of you that may be worried about the fact that we don't use all the letters in the mnemonic, there is something called the Zeigarnik effect from psychology. It says that you remember incomplete tasks better than complete ones. The incompleteness may improve the mnemonic stickiness.